Today's video highlights 7 critical stroke symptoms that can appear up to a month before the event occurs. Strokes are medical emergencies that can happen to anyone, regardless of age, gender, or overall health. It's crucial to recognize these early signs, as they can significantly increase the chances of preventing brain damage. Recognizing these symptoms early and seeking prompt medical intervention can make a substantial difference. Globally, strokes are a leading cause of death, with over 695,000 Americans experiencing a stroke annually, and nearly 155,000 fatalities. This video aims to educate on how to identify these warning signs early, potentially preventing strokes and reducing the alarming statistics associated with this condition. Join us as we explore these symptoms and discuss preventive measures. Many symptoms that manifest a month before a stroke are subtle and often go unnoticed, leading to their misinterpretation. It's essential to recognize these early warning signs, regardless of age, health condition, or existing comorbidities, as strokes do not discriminate. Staying alert and informed can be crucial. Sharing this knowledge with friends and family could potentially save lives. This video will also explain the differences between ischemic and hemorrhagic strokes to enhance your understanding of these medical conditions. Furthermore, we'll discuss brain aneurysms, including their warning signs, and highlight the importance of recognizing transient ischemic attacks, TIAs, which may precede a stroke. Understanding these signs and symptoms could be life-saving. Now, let's explore the 7 signs or symptoms that may appear a month before a stroke. Should you experience any of these, immediate medical attention is advised. Symptom number 1: persistently elevated blood pressure. Persistently high blood pressure is a critical indicator of increased stroke risk, underscoring the perils of unmanaged hypertension. Blood pressure, the force of blood against artery walls, becomes a significant health concern when elevated, known as hypertension. This condition can lead to damage within the blood vessels, causing them to narrow, weaken, or rupture, significantly elevating stroke risk. Specifically, a rupture in brain vessels can lead to a hemorrhagic stroke, while damage to arteries supplying the brain can impede blood flow or cause blockages, leading to an ischemic stroke. Consequently, effective hypertension management is imperative. Lifestyle modifications and strict adherence to prescribed medications are fundamental to controlling blood pressure, significantly mitigating the risk of stroke and other cardiovascular conditions. Symptom number 2: excessive fatigue. Excessive fatigue, or unusual tiredness, may serve as an early warning sign of a stroke. It's crucial to distinguish this fatigue from the normal tiredness associated with physical exertion or lack of sleep. When you experience persistent, intense tiredness without an apparent cause, it could indicate a serious issue. This type of fatigue might stem from changes in brain blood flow, possibly due to artery narrowing from atherosclerosis or a clot, affecting oxygen supply. Such abnormal tiredness warrants a medical evaluation. Notably, extreme fatigue could signal a transient ischemic attack, TIA, a temporary blockage in blood supply to the brain that acts as a warning for a possible future stroke. TIAs cause temporary symptoms, similar to a stroke but resolve within 24 hours without causing permanent damage. The body often dissolves the clot that caused the TIA, eliminating symptoms. This quick resolution, however, is a critical alert to the potential risk of a stroke. Paying attention to and acting on these transient symptoms by seeking prompt medical care is vital. Symptom number 3: vision problems. Sudden changes in vision, including blurriness, double vision, or difficulty focusing, should be taken as potential warning signs of a stroke. These vision issues may indicate damage to the circulation in the brain. While vision problems can arise from various causes, it's imperative to not dismiss these symptoms lightly. Vision loss or significant changes may occur due to an artery blockage that supplies blood to the eye, which is often a precursor to an ischemic stroke, the most prevalent type of stroke. Recognizing and addressing such changes swiftly by seeking medical evaluation is crucial for early intervention and stroke prevention. Symptom number 4: sudden and severe headache. A sudden, severe headache may indicate an impending stroke, although it's important to recognize that not every headache is stroke-related, and not all strokes include headaches as a symptom. In the case of an ischemic stroke, headaches arise due to the obstruction of blood flow in the brain, which is characterized by their sudden and severe nature. Hemorrhagic strokes, on the other hand, cause intense headaches due to bleeding within the brain, which increases intracranial pressure and subsequently elevates brain pressure. Individuals experiencing a stroke often display signs of acute distress, such as clutching their head in intense pain, which can lead to a loss of consciousness, especially in hemorrhagic strokes. Additionally, a severe headache might signal the risk of an aneurysm rupture in the brain, necessitating immediate medical attention. Symptom number 5, numbness or weakness in body extremities. Numbness or weakness in the extremities, particularly when it's localized to one side of the body, can serve as a critical alert to an impending stroke. These symptoms often occur during a transient ischemic attack, TIA, which is a brief interruption in the blood supply to part of the brain, leading to temporary numbness or weakness. This typically impacts a specific area, such as an arm, leg, or one side of the face, and can result in a loss of sensitivity. While these symptoms might last only a few minutes to a few hours, they are significant warning signs that should not be ignored. An immediate medical evaluation is crucial, as these symptoms could indicate a stroke or another neurological condition. Symptom number 6, speech problems. Speech difficulties are significant indicators of an impending stroke, manifesting as slurred speech, trouble articulating words, or forming complete sentences. These challenges fall under the umbrella of aphasia, a condition characterized by the impairment of the ability to understand, formulate, and express speech. Aphasia indicates potential damage or disruption in the brain areas responsible for language, often triggered by reduced blood flow during a stroke. Recognizing and responding to these symptoms promptly by seeking medical attention is crucial for timely intervention. Symptom number 7, neurological problems. Neurological symptoms preceding a stroke, whether hemorrhagic or ischemic, can vary widely, encompassing memory issues, loss of balance, as well as nausea and vomiting. These symptoms could surface days or even weeks before a stroke occurs. However, it's important to note that a range of other medical conditions can also manifest similar symptoms, thereby complicating the diagnosis. Conditions such as migraines, seizures, hypoglycemia, brain tumors, anxiety attacks, and infections of the central nervous system are known to produce similar signs. Given this complexity, seeking a thorough evaluation from a qualified healthcare professional is crucial to accurately identifying the cause of these neurological symptoms. The key difference between an ischemic stroke and a hemorrhagic stroke lies in their underlying causes and the resulting impact on the brain. Ischemic stroke. The primary cause of an ischemic stroke is the obstruction of blood flow to the brain. This obstruction can result from a blood clot, thrombus, that forms in another part of the body and travels to the brain, embolic stroke, or by a buildup of plaque within the arteries that lead to the brain, narrowing and eventually blocking them, thrombotic stroke. Atrial fibrillation, a type of heart arrhythmia, disrupts the smooth flow of blood through the heart, increasing the risk of clot formation. These clots can then migrate to the brain, causing an ischemic stroke. Conditions that elevate the risk include high cholesterol, hypertension, diabetes, and smoking. These factors contribute to the development of atherosclerotic plaque, which narrows and can block cerebral arteries. Ischemic strokes are the most common type, accounting for approximately 85% of all stroke cases. The lack of blood flow results in oxygen and nutrient deprivation in brain cells, leading to the damage or death of these cells. Hemorrhagic stroke. A hemorrhagic stroke occurs when a blood vessel in the brain leaks or ruptures, leading to bleeding in or around the brain. This bleeding can increase pressure within the skull, causing damage to brain cells. There are two main types of hemorrhagic strokes: intracerebral hemorrhage, where the bleeding occurs within the brain tissue itself, and subarachnoid hemorrhage, where the bleeding occurs between the brain and the membranes that cover it. High blood pressure is a leading risk factor for hemorrhagic stroke. Other factors include aneurysms, arteriovenous malformations, AVMs, and certain blood disorders. The bleeding can cause brain cells to be damaged or die from the increased pressure and accumulation of blood. It can also disrupt the normal flow of cerebrospinal fluid, leading to further complications. In a hemorrhagic stroke, blood leaks into the brain due to a burst blood vessel, leading to pressure and damage to brain cells. This contrasts with an ischemic stroke, where blood flow is obstructed. Both types are critical and demand prompt medical intervention. A prevalent cause of hemorrhagic stroke is a cerebral aneurysm, an abnormal bulge in a brain artery that can rupture, causing bleeding. Many aneurysms remain asymptomatic until they burst, leading to a stroke. However, certain symptoms may hint at the presence of an aneurysm, underscoring the importance of immediate medical consultation upon suspicion. While not all aneurysms rupture, and many individuals live with them uneventfully, awareness and monitoring are key due to the potential severity of a rupture. How to detect a brain aneurysm? Doctors use specific imaging tests such as CT angiography, MR angiography, or cerebral arteriography to identify cerebral aneurysms, particularly those at risk of rupture. Diagnosis is often pursued in individuals with a family history of aneurysms, given that many aneurysms are asymptomatic. How to prevent a stroke? Key measures include controlling blood pressure and blood glucose levels, maintaining a healthy weight, regular exercise, eating a balanced diet, avoiding processed foods and excessive consumption of sugar, saturated fats, and alcohol, quitting smoking, ensuring adequate sleep, managing cholesterol levels, and regular checkups with a cardiologist. If you found the video informative, please give it a thumbs up and share it with your loved ones to spread awareness. Subscribe to our channel and hit the notification bell to stay updated on our latest videos. We're interested in hearing your thoughts on the early signs of a stroke. Feel free to leave a comment below. Also, check out other related videos on our channel for more informative content. Thank you for watching, and see you in our next video.